Hello and welcome to another episode of Listen to Daddy. I am one of your hosts, Daddy Rob, and today, yes, it's wonderful. And today we have an extra special guest who is really, really hard to get. I don't know what contacts you used to arrange this, but I'm going to go ahead and let you introduce our special guest for today.
He's actually no stranger to Listen to Daddy because of a very special episode that we had a year and a half ago on relationships. We are actually inviting the one, the only Damon L. Jacobs of Tub Talk fame to actually, yes, welcome, welcome, welcome. Thank you, thank you. We
A
are very
celebrity.
excited to have you here. This is technically not a Tub Talk Listen to Daddy crossover, even though you are in the tub, as per brand. Actually, this session is about, believe it or not, the very sexy, the very important talk on STIs. And for those of us who don't know, STI stands for sexually transmitted infections. April has traditionally been STI Awareness Month. And so, in talking with Rob, we thought, you know what? Right, like we never talk about sex. Like we never talk about sex. But we think it's also important to talk about, like what can we do, particularly as older gay men, to really protect ourselves and what things do we need to be aware of? And who better than one of our leading PrEP activists, our leading health activists, mental health professionals in Damon L. Jacobs. So, Damon, again, we want to say thank you for coming to Listen to Daddy. And is there anything else you want to share with us before we get started?
Well, I'm just so glad to be here. I'm glad to be back on the show. I love this show. I love the content. And Rob, I want to thank you because I don't think anyone's ever described me as hard to get before. So, there's still new things we can do in our 50s and upward. That's great. And yes, I get a real bath with real bubbles.
Yay!
And I love your ducks.
Thank you.
Go Elphaba.
There we go. Falba. I got a whole family around here. Yes.
And having been in your tub, I can tell everyone it's a wonderful tub. It really is. So why don't we get started? So again, Listen to Daddy by for and about older gay men. April is STI Awareness Month. I know I have my own ideas. Rob has his own ideas. Why talk about STIs, Damon, particularly as it relates for older gay men?
Well, for so many of us in our generation, we grew up in the shadow of HIV and AIDS as a traumatizing introduction to sexuality and sexual expression. So a lot of us came out either right at the time the crisis was hitting or sort of right after with the experience of sex and sexual connection as something to be afraid of. And although in the last 10, 15 years, we have focused in the health community on prevention and strategies to reduce HIV, including the U equals U movement. And I'll just, for those who may not know that, the idea and the science that supports that someone living with HIV cannot transmit HIV, which is really, really important when we talk about ending HIV or reducing HIV. And then there's PrEP. PrEP is something an HIV negative person would use. It's a daily pill that prevents HIV. So we have all these amazing, amazing experiences in technology, but then we kind of forget that there's still other things that might compromise our emotional and pleasurable satisfaction when we are having sex, especially when we're enjoying sex with multiple partners without any condoms, which I do all the time, which I enjoy a lot. So even when I started using PrEP and the fear of HIV started going away, which was magnificent and amazing back in 2011, I still had that lingering shadow of like, okay, but what about this? What about syphilis? What about gonorrhea? What about chlamydia? What about these bacterias? What if I get these? What if I spread these? What am I going to do if I have to get tested? Where if I have to get treated? How am I going to do that? Where am I going to do that? And that was still affecting the fear. And in my world, mental health and sexual health are very much intertwined. If you have access to one, then you definitely have a portal to the other. And what I found is that the more we talk about sex without fear and actually find strategies and biomedical innovations for having sex without fear, the more joyful our lives become, the more pleasurable our sex becomes, and the more we navigate the world with a greater locus of control and ease and sense of like, okay, there's so much going on in the world I can't control, but here's something I can. I do get a say in HIV. I do get a say in gonorrhea, chlamydia, and syphilis. I can control for those in a reasonable way. And that does lend itself to a greater locus of control and self-efficacy as we navigate the painful things happening in our world today.
I think we know that there is some hesitation for people to have a open sex life based on the society that we're in. I mean, we're really puritanical in that way. What would you say to somebody as a mental health professional, bridging that the gap as a sex expert? What would your advice be to somebody who tends to stigmatize an STI? Like if they decide to open up their sexuality and then they get a let's say syphilis or gonorrhea, something that they feel is like a punishment for that act, because it all ties into that Judeo-Christian line that we get about sex and sexuality. What's your advice to somebody to kind of live with that as the reality of having sex?
So I would say exactly beginning where you said, this is not a punishment. STIs and bacteria are not a punishment for behavior. If I had dinner at a different restaurant every night of the week in Manhattan, I wouldn't be called a whore, I'd be called a foodie. And what if I had food poisoning? What if I ate the wrong thing or something wasn't prepared well enough and I spend the entire night vomiting and shitting myself because I got poisoned by eating the wrong kind of food while pursuing pleasure? I generally wouldn't get stigmatized or blamed or shamed for that in a puritanical culture. We don't generally blame people when car accidents happen. We may try to find liability, but we don't call people Toyota whores if they get in car accidents. So we tend to accept a level of risk in most activities in our society except sexual pleasure. So that's where I start. The pursuing of pleasure is human, is natural, is beautiful, is celebratory. And when something goes awry or something doesn't go the way we planned, it is what we want to pivot from is the punishment and I told you so, you dirty whore, and really move into how can I help you get better and how can I help you continue to feel good and empowered about your body and your sexual pleasure.
Well, I'd be lying if I didn't get excited when you call me a dirty whore, but I'm going to let Ron ask the
first time.
Yeah. So it's this entire toolkit, and I just want to say, because while we're talking about this, it reminds me. So I was just in Atlanta this past week, and I was attending a conference called the HIV Biomedical Prevention Summit, which rolls right off your tongue, but the focus was on PrEP. But this is Atlanta. And for those of you who are bottoms out there who understand the struggles of bottoms in the United States, in most U.S. cities, in my experience, there's usually a disproportionate amount of bottoms to tops, except in Atlanta. And Atlanta is one of the few U.S. cities where the scales are tipped in favor of bottoms looking for tops. There's often as many or more tops than bottoms out there. So because of that, I had a really great time in Atlanta. And because I had some really amazing sex without condoms in this past week, specifically in the last 70 hours before we're recording this, I wanted to make sure I was going to reduce any possibility of obtaining gonorrhea, chlamydia, or syphilis as a result of having sex over this last week, specifically in the last 72 hours. Now, I'm already taking daily PrEP to prevent HIV, which feels amazing. But now, I remind after I get back, after my trip, to take 2 100 milligram tablets of doxycycline in order to minimize the possibility, and they're very small, maybe you could see them right there. In order to minimize the possibility that I could now get gonorrhea, syphilis, or chlamydia as a result of having sex with multiple partners without condoms in Atlanta. So here we go. Here's one, and here's the other. So what I'm doing is taking 200 milligrams of a generic drug called doxycycline. Doxycycline was first approved in this country in 1967, and is commonly used for ailments such as acne, malaria, prevention of malaria, oh God, there's so many other things, gum disease, and it's commonly used for so many other things in this country, prescribed to approximately 20 million Americans every day since 1967. Now it just so happens that one of the bacteria it turns out it works for is preventing gonorrhea, syphilis, and chlamydia. Not by 100%, mind you. This is not harm elimination, but it's harm reduction. When I take these 200 milligrams after having sex, I'm reducing the possibility that I'm going to get chlamydia by 89%. Syphilis is 88%. And gonorrhea is a little lower than that. The numbers on gonorrhea are a little unsure, but it might be closer to 50% or so. Nevertheless, 50% protection from gonorrhea is a lot more than zero. So I take these drugs, and I've been taking them regularly since 2017 to prevent STIs, along with daily PrEP to prevent HIV. This gives me a toolkit of options to be empowered and fear-free when I'm having the kind of sex that I want to have. And it's amazing to me in my 50s to get to have these opportunities for the first time in my life, because I came out in 1988. I came out in the shadow of HIV and AIDS. My sexual coming out was really based on being afraid that I'm going to have to die for bottoming and for loving bottoming so much. And it wasn't until I was in my 40s that I could begin to be relieved of the fear. First, the fear of HIV with PrEP, now the fear of STIs with doxypep as well. This is amazing. I really, really, really never thought I was going to get to see this at all in my lifetime. And to still get to have all this fun in my 50s is just like, bam, that was better than anything I had planned.
And Doxy is still prescription only, correct?
It is prescription only. Again, it's a very generic, ubiquitous drug that's used for so many other causes in the US. But yes, right now it's still prescription only. I wish that were different. And different states have different ways that you can get it. Like some, a pharmacist can prescribe it. But I think in California, a pharmacist might be able to do it. I can't remember that right now. But yeah, it is still being guarded through that system.
One of the things I would add as I get ready to take my doxy was, again, while you were in Atlanta having the fun of having your fun, I'm here in DC. I've got my other regular play partners, I should say. So Daddy had his fun too this weekend. So I'm about to take mine in a few minutes. But I think it's important to note that in addition to pharmacies and getting it through prescription, there are many clinics, particularly LGBTQ and LGBTQ friendly clinics, that do offer it free of charge because of current funding that they can so they can access doxypep. I think it's just, again, not only wonderful that, and especially someone like myself who's HIV positive, who unfortunately HIV came to live with me before the advent of PrEP, I have something now that I can take advantage of, to at least reduce the risk of, you mentioned syphilis, gonorrhea, and chlamydia as well. And I'm glad I can take part in that as well. I also like the fact that, a lot of times when we talk about public health campaigns, they don't feature men of our age, or the men of our age may be featured with a younger man, but not with each other. And I think it's important that, we show and we talk about, hey, we're still getting it on. We're still getting it in. And I think there's some stigma around that. Rob and Damon, you both are mental health professionals. I can talk about that from a community's perspective, but what you've seen in terms of older men either embracing their sexuality or still struggling with it?
Well, there's a lot of men of our generation that came up with in the HIV era. I mean, I came out about the same time you did, Damon, and and a lot of us went immediately into either one-on-one relationships that last, like what is it?
Serial monogamy.
Serial monogamy. Yeah, whatever it was one person at a time. We weren't sleeping around, and as PrEP has come out, more and more people of our generation are taking that step into multiple sex partners. So a lot of them who avoided any kind of STD just simply out of fear, like you said, of doing as little as possible to expose yourself, are now, for the first time in their life, kind of experiencing things like gonorrhea, or even was it dick lice? What the hell are they called?
Pubic rats.
crabs, yeah, for the first time. So they're not really sure what to do about it, and they're embarrassed about it, and they're having a little difficulty getting help for it when they see any signs for it. And this might be a good time, Damon, to remind people who may have not have had an STD ever or not for quite some time, what are some telltale things that you might notice happening that might necessitate going and actually seeing a doctor to have it checked out if you haven't proactively taken your doxy?
Yeah, I mean, look, if you suspect, if you feels to you something's wrong down there in your penis, in your butt, in your throat, in your vagina, if you're a vagina having person, then get it checked out. Like, just do what you can do. Especially if you can access a clinic or a tester somewhere in your area, get it checked out. If you're wrong, you're wrong. But if you're right, you're right. What are some of the signs? I say if it's burning, itching, or twitching, and you want to, it's a good time to get it checked out. A lot of times as bottoms, we don't know that there's bacteria in our butts. We don't know, especially with chlamydia. Chlamydia is often called the silent STI because you can really have it and not know it in your penis and in your butt and in your throat. But if you suspect that it might be there, do it. And for those using PrEP, and for those, the sluts, and sluts is a very affectionate term that we often use, we are expected to get regular 3-site STI testing every 90 days. 3-site means throat, penis, and butt. And that also then helps to sort of filter out a lot of STIs that might be there that we might not even know about.
Yeah, I think a lot of people think they take that one pill, they're going to be free.
That what?
I think a lot of people think they take that one PrEP pill and they're going to be free of any problems, but they forget that there are still other STIs out there.
I don't know, Rob. In my world, it's really the opposite. I see a lot of people who worry, especially our age, because we've been programmed to worry. We've been programmed to associate sex with fear. So I generally see the other side of that. I generally see people who are like, but, what if PrEP doesn't work? Oh, what if I drink grapefruit juice at the wrong time of day? What if I break a toenail? What if I get a lot of what ifs from the worried well when I talk about PrEP. And I think where people could eventually get to, and where they usually do get to, is that liberated place of being able to say, I'm going to do this and I'm going to enjoy this. But there is usually a process of that. For me, it took a year. I had to take PrEP for an entire year, actually a year and 2 months, before I actually could fully wrap my mind and my heart and my butt around the reality that this works. That it actually scientifically, biologically works, so that if HIV enters my body, it cannot duplicate or replicate. It took me a long time to actually believe it, to translate the science that I knew here into the experience I could feel here. And that's a journey that I think takes a while for a lot, especially people our age. It takes a while. But, it's like, yeah, I mean, it protect you from car accidents. It doesn't protect you from food poisoning. It didn't protect me from jury duty. I mean, it's like PrEP does what PrEP does, and it only does one thing, and it does that one thing very, very well. Doxycycline actually does 3 things, and it does those 3 things well, but no, it doesn't protect from lice, and it doesn't protect from hepatitis, and it doesn't protect from COVID. I mean, it's like that's not what these drugs do. They do what they do, and they don't do what they don't do, and that's true for all prevention and treatment drugs.
Yeah, a couple personal anecdotes. Number one, I started taking PrEP at the beginning of lockdown. So I was taking it for a good amount of time before I could actually hook up with anybody that I hadn't before. So that was an interest. I had plenty of time to kind of work that out in my head, what the hell I was doing. The other thing I wanted to share was I had sex early on in my life with somebody who landed on his knee on my erect penis, which snapped it. And I immediately went to the ER, gripping my bleeding member in my hand. And one of the first questions I got was, when did this happen? And I said, it just happened. Why would I wait? And she said, the nurse at the front said, you would be surprised how many people, if it's something of a sexual nature, will wait as long as they possibly can before they come in and get it treated, which makes it even more difficult or a longer process of treating. So what I came away with is, if you are old enough to have sex, you're old enough to talk about it, and you're old enough to get it taken care of when something goes wrong. It's I think far too many people are worried about what doctors think about them, and the doctors are just waiting to treat people. Most doctors are just there to provide assistance, not opinions.
Well, Rob, I would push back on that a little bit because I think it kind of depends on a lot of factors. I think doctors are, not all, but a lot of them really do stigmatize with an implicit bias that, as we said earlier, sex is shameful, Puritan ethics, and sometimes they do act insensitively and they do promote stigma against people who are coming to help for sexual health or because something happened during a sexual experience that was, unexpected or painful or traumatic. There are doctors who really do stigmatize and judge that. But my sort of way around that is reminding people we are consumers of medical health. We're not patients. The patient model is one in which passive and we accept the authority of the almighty God doctor and just sort of take what they say at face value. The consumer model is saying we have a right to access scientifically driven medical care, which is sometimes well tested and other times it's harm reduction, but we have a right to access data driven sexual health. And if you, as my doctor, are acting like God, persecuting me and trying to make me feel embarrassed or ashamed about being a sexual person, then I'm going to consume medical services from someone who is willing and able to step up and help me. And
I'd
that's a
agree
lot
that
of
the stigma
what
exists.
Rod and I talk about is with doctors is that we try to help them understand where they might be getting in their own way for doctors who want to do a good job, where they might be applying implicit bias and inadvertently shaming people, and how we can help them sort of get around that so people don't walk away from them feeling bad about themselves when they're coming for help at a really, really, really vulnerable time in their lives.
And it's also very interesting. What we're not talking about is the implicit bias or explicit bias when it comes to older people having sex. It's very interesting how, and I've noticed among providers, that if a young person, and by young, I'm really meaning under 30, comes in for STD testing, particularly if it's a young man, it's almost treated like a rite of passage. It's like, okay, you've been getting some, you got burned, it happens, this is what you need to know. The older that same patient gets, the older that same client and consumer gets, it's like, don't you know better? And what are you doing out here in these streets? I have seen and I have heard providers, particularly in clinics, if not to the client themselves, at least when we would talk as the staff, as the team. There's a lot to be said, believe it or not, against people who are older and who are still sexually active and who may have to come in because they got an STD, especially if they've had more than one partner. If it's one partner, then it's like, oh, you're the victim. Oh, I'm so sorry to hear that. Oh, versus, oh, you would, oh, okay. More than one partner. That certain look as you check that off on the checklist. And I think there has to be also, and this is the work Damon, you and I do, around destigmatizing people having sex and destigmatizing what we call elder sexuality. I'm not sure I like that term, but the point is people who are older having sex. That is still a concept folks are still wrapping their minds around.
They are, and I want to say that's true definitely for same-sex LGBTQ community, but I just want to say that's also true in the straight community, that STI rates are abnormally high in areas where there's a lot of elder straight people living, especially homes or residential homes. There are really high STI rates there and in a lot of these places. And what does that tell us? It means people don't stop having sex, even if they don't have physical autonomy in other ways, and that if you get enough people together in enough space, they're going to be having some fun and play. And if there is a bacteria floating around, a lot of people are going to get them. And that is a conversation, that ageism, that expectation that older people are not enjoying bodies and other people's bodies. That does need to be defined. And the data says that, no, we are having sex and when there is a bacteria, we are spreading it. So that doesn't make any sense from a data point of view, is this assumption and notion that older people don't have sex. Yet in this country, that is still the prevailing narrative that gets in the way. As you said, way of public health campaigns. Yeah.
Yeah, I think they have less education in the straight, particularly the older community, about STIs because they've lived this privileged existence where their sexuality has been put on a pedestal, and they've been doing the quote unquote right thing all their life, so nothing will ever happen to them. But then they either lose a spouse for one reason or another, or they hit a point in their relationship where they want sex and their longtime spouse is no longer having it, so now they're back in the world where things happen to people and it doesn't matter what you think, whether you're good or bad, it happens to everyone. We're all human beings, and things can happen, and we need to be able to approach that. And I didn't want to imply that I wasn't aware there was stigma in the medical community, but I don't want anybody to ever not seek help because they're afraid of it. It's like I've been blessed to be in metropolitan communities where there have been LGBT medical centers. So I've been lucky that in those centers there's always been warm and receptive people who are willing to work with me on whatever my issues are. And I know it gets a little harder the more rural, the less different types of people are, the more homogeneous an area is. It's harder to find care that's going to reach out to you in a way that you can receive it and not be invalidated. But I know the stigma is there, but I never want anybody to let that be the thing that stops them, because something small can turn into something big. So if you've got, like I said, the itches, the twitches, whatever you have, as soon as you see it, go and see somebody, because it's worth it to prevent something worse down the line.
Yeah, and you're going to have to eventually anyway. So it's, if you do suspect something, it's better to get it treated earlier than later. And again, if you are in a situation where you are forced to deal with a provider who is going to stigmatize you, they're going to do it whether it's a month from now or 6 months from now. But at least you can get the treatment you need earlier than later. And then as a consumer, say next time, I'm going to someone who's going to treat me with dignity.
Yeah.
And one of the other things we don't talk about is, do we ask our friends, hey, where do you go to get treatment? Where do you recommend? And I think that's the other thing around community, around resources, around the internet, that we can access, or we have a better chance these days of still accessing LGBTQ friendly, even elder friendly sexual health services. And I'm thinking about particularly in New York City where, SAGE, and I can never remember SAGE, Senior Action in a Gay Environment. That's it. Where they're based. They work with organizations all the time to have sex positive, LGBTQ friendly, elder aware, and elder friendly services. So yeah, we've got options that we may not have had before.
Yeah, and I'm currently in Palm Springs, where right down the street from me is the Desert AIDS Project. And so, like I said, I've been fortunate that the places I've lived, but I've made choices based on what those areas have for my husband and I. I take those kind of things into account when I'm deciding where I want to live. And I really appreciate the work the two of you have done to kind of educate medical professionals so that there's hopefully less stigma in the world than there was before in that field because of the work you've done.
And speaking of which, Damon, shall we let the cat out of the bag about Denver and July?
Oh, yeah, go for it.
So Damon and I are actually part of a group of older gay men who are professionals in HIV prevention, who we do a round, I don't know what they call a panel actually, called We Have Sex Too, Older Gay Men in Sexual Health Matters. And our abstract was just accepted for the National Sexual Health Conference that's happening in Denver this coming July. I'm ecstatic, I'm thrilled, and it gives us a chance, once again, on a national scale. I say once again because we've done it before, but once again, we get a chance to really bring these issues to light. That older gay men, first of all, we exist in healthcare, we access services, and we are having sex, and we need sexual health services. And what I love about it is that each of us tell our stories around accessing sexual health. Damon, you tend to focus on PrEP. I talk about the lack of sexual health services after I had my heart attack. We've had people talk about cancer issues, substance abuse issues, and just really how older gay men present with a variety of physical and social issues that, as providers, we need to keep in mind. So I'm excited. And Denver in July is quite cute, I might add, having been there before.
Congratulations and well deserved.
What's exciting to me as well is that this is the first time we've done this or been accepted outside of a conference that's specific to HIV. that this is a general sexual health. And that's really, really, really hopeful and exciting to me that this conference is not specific to queer and it's not specific to HIV. And they want to hear our stories. They want us to talk about the things that we talk about, queer older men who like to fuck. That's sort of what I call it. We have sex too. I call it, queer men, older men like to fuck. That's sort of my title of our program. And that they were receptive to this idea and that they invited us to be part of this. I think that's very promising.
I'm very excited.
Yeah.
So what's the next frontier? I mean, like if you could just wave a magic wand and have something change in the way that either the medical community responds to STIs or people themselves kind of self-advocate or self-medicate, what's the next big stumbling block that needs to be taken out of the way?
I mean, it's still stigma, and highest rates of HIV are still being diagnosed in 9 states in the southeast of the United States. And it's often where Medicaid is not expanded, and it's often where doctors are practicing a lot of religious-based medicine. So if that was up to me, I'd send Daddy Rod down there and have him do a little tour where he goes to clinic and helps people understand, for those who have the best of intentions, or at least decent intentions, help staff understand how they can communicate and relate and engage the community in ways that are respectful and sex affirmative, because he's really good at working with people and helping them see where they might have some implicit bias getting in the way, resulting in higher HIV rates, resulting in higher STI rates. That would be my hope. I think the community, the more you do that, the more you normalize it. The more we talk about these things, the more we talk about HIV and STI and pleasure, the more it's normalized. And once people normalize, it doesn't feel as big a deal to go to that clinic and ask for the kind of care and prevention and treatment you need to get.
Yes.
And of course, I'm not ignoring what else do we need? Well, I think we need a democracy to still pursue all this. And I'm worried about that right now. So there's that.
And I'm glad you brought that up, because one of the questions I wanted to ask you, with all of the, and I'm going to call them what they are, attacks on public health and public health initiatives that the current administration is doing. One of the areas that is of concern is the current administration taking aim at PrEP initiatives. It was part of their Project 2025. Currently, can you help us separate fact from fiction in terms of, is it being cut? What is at stake? Especially as we're talking about PrEP, we're talking about doxyPEP. It's one thing to have the awareness. It's a whole nother thing to have the access to even know if it's still going to be available. What can you update us on about that?
Well, so right now, the problem with PrEP, or the fear with PrEP, is that there will be rollbacks because of what's happening in Texas. What's happening in Texas is that there's people in the state that have pushed for PrEP not to be covered or not to be automatically covered under ACA Affordable Care Act-based plans. And they're likely going to win that legal fight. It will probably go to the Supreme Court. We know which way it's going to go if it goes to the federal Supreme Court. Federal Supreme Court is going to say, yes, the states can say no to covering PrEP under ACA, under Affordable Care Act. Once they do that, we've seen how this goes. We've seen how this goes with reproductive rights. The red states are going to roll back everything. The blue states are going to be like, we're still going to do what we got to do. So the question is how PrEP will still be accessible. And we already have so many barriers to PrEP access in these 9 states of the Southeast where HIV rates are the highest prevalence. Those are the states that are likely going to roll back if they're given the chance to do so and not cover PrEP under the Affordable Care Act. That's not going to be the end of PrEP, but it's not going to be a helpful thing either. What we need to do is to be able to, again, normalize these conversations so people can be more of a consumer and an advocate. Because people who want PrEP are going to have to work harder to get it, but it's still going to be there. The slutty genie is out of the bottle. It's not going anywhere. Fortunately, PrEP in oral pill form is generic. What that means is that, again, it's not free, but it's certainly more affordable than it was before when there was only a brand, a pharmaceutical company making a specific brand. The injectables are coming, and innovative for the science. That's really exciting because we're getting long-term injectables for PrEP. Right now, we have an 8-week injectable already FDA approved, and in June, there will likely be a 6-month injectable PrEP that's going to be FDA approved. But how anyone's going to get their hands on this in the middle of this mess with democracy and with these rollbacks is anyone's guess right now. But that just means that we as consumers have to be motivated and use community and talk with each other about ways that we can still access PrEP. You know, doxycycline's been with us since 1967. This is not a brown drug. It's pretty cheap. I just don't even use my insurance. I just order it from Amazon, and it's about $20 for 30 pills. And it's really pretty easy to get. We have to continue to have conversations that help people say, if you're in an area where you can't get PrEP, here's how you can get it, or here's ways that you can get it through a generic pharmacy. There's going to be ways, it's just going to be harder. And for some people who are already facing a lot of obstacles, this is going to be yet one more obstacle that's not going to be helping us get to the end of the HIV epidemic by 2030.
Which is only 5 years away.
Only 5 years away. They, you know, back when we had a compassionate White House, they would put up these goals on their website to end the epidemic by a certain year. You know, it was 2010, it was 2020, it was 2030. Well, you know, we don't have that anymore. That's gone. That's, you know, because and that plan wasn't really going to work anyway with the way things have been going, even under the better administrations. But nevertheless, it's not going to be helpful to have ACA plans saying, no, we don't want to enable your, you know, sinful, dirty whore ways. We're not going to pay for it. We're not going to use the taxpayers to pay for it, even though we know that PrEP works. And we know that areas where there's high adoption of PrEP, that HIV rates go down significantly. And now we also have the data that shows that in areas where doxypep is being adopted, that STI rates are going down exponentially. San Francisco Department of Health published the data on this, that they were offering doxypep to anyone who came into one of their sexual health clinics and said, if you want this drug and you want to prevent STIs, we're going to give it to you for free. And give it to you and just help you have it. And they saw their STI rates go down by 51% over a 12-month period. So when we live in areas where doxypep and PrEP are normalized and easily accessible, and where HIV is not stigmatized and not harmed, that more people adhere to their medicines and then stay undetectable, we put all these things together, and that's where we have a plethora of sexual health and joy. The sad part of that is, again, it feels more and more now it's going into the silos, into the blue cities where this is the case, and not into the red states or the rural areas where we really, really, really need to have these innovations available and accessible and affordable for people.
And I think we're all of an age that recognize as gay men that top down is never going to serve us. It's got to be us making the change bottom up, so to speak. We've got to kind of band together and get this message out and go, you know, encourage people to continue to go into areas where, like I said, there's restrictions, and kind of provide a conduit to the assistance they need. So I'm grateful for the work that you two have done in that particular area, because it's that's where it's going to come from. Our people of our community making some noise and making some effort to counteract what the institutions are failing to provide, which is freedom and health for all.
Yeah. And so we can look, everybody who can watch this show means they have a Wi-Fi connection, and anybody with a Wi-Fi connection can be an important conduit of valuable information and pleasure-based education for their community. Community is a very large word. You know, I still use Facebook quite a bit to help people learn about innovations of doxypep and PrEP and how to get it in their areas. And I started an international group on Facebook that's still very active today, with over 20,000 international members, where people are talking about this and sharing resources in their local areas. So we all have a voice, and we all have a role to play, and we're all going to have to step up to that, especially if and when these rollbacks happen. With our current political climate. You know, we can't depend on federal funding to tell us what's going on. We have to give it to each other and give each other the resources and the data that will help and sustain proactive, responsible, empowered pleasure.
I'm also wondering if it would be worth it for us to really encourage people in our networks, if they're not on PrEP yet, if they're not on doxypep, even if they've fallen out of care for HIV medication, now is the time to really access and get as much of the treatment as you can. Because
I know some people are stockpiling, and that's fine. Do it, you know, why not? There's no harm, and I don't know if it's necessary, but hey, It's better to have it than not to have it. And if you are going to have these drugs, if you are going to stockpile them, I would recommend storing them in a cool, dark place, like a file cabinet or a shelf. Some of them are really not recommended that you refrigerate them. So check the label, ask someone. But if you're going to stockpile HIV meds or prevention or doxypep, it is generally recommended a cool, dry place to store them if you're not planning to use them for several months.
And hopefully this struggle is just today and eventually will be yesterday, because we have seen throughout our lifetimes this tremendous gain in what we as gay men have had access to in order to live more fulfilling lives. You know, that from representation in media to PrEP to all these things that have allowed us to have like this little section that we can feel like we are have some hope in. So it's in the long haul of everything. Hopefully, it continues to move towards a true freedom from that kind of stigma that we were talking about in repression. But today, we have to get through this and whatever comes next. But bearing in mind that the impact that we've seen in the past from this kind of work has led us to this moment that we're at now, and we know how to do this. We just need to continue to fight the good sex fight.
Yeah, I mean, a lot of people this week at the conference I was at said exactly that. And in my own tub, I'm going to do a shameless plug, but I just had a 2-part episode with Jim Igo, who was one of the founding members of ACT UP here in New York City. And his work is featured in the documentary How to Survive a Plague, which is here on YouTube. So if you're watching this on YouTube, you could watch How to Survive a Plague, an Oscar-nominated documentary. And it really showed how that group of activists, in a time when the government was content to see us die in the streets during the AIDS crisis, that this group banded together and through community and activism made a difference. And most of my career, I've been coasting on their activism and the hard work that they did throughout the 80s and early 90s. Yes, Rob, as you point out, now is the time we're probably going to get back to that. We have to, and we have to get back to community-based activism. But we don't have to reinvent the wheel on this either. You know, we've done this under the Reagan administration. We can do this under the Trump administration. It is possible. It doesn't have to be done exactly before, but there is a playbook to follow here, thanks to those early courageous activists. And we can adapt that to what we're facing today.
Yeah, the good news is we have that history we can pull from, and that we can. Yes, we can. Whatever it is, yes, we can.
Yeah, and speaking of aging, I mean, Jim Igo, if you watch my Tub Talk with him, he's 73 years old. This dude is stacked. His chest, his body, he's like in amazing shape. You watch Tub Talks with Damon, the 2-part episode with Jim Igo. So he reflects on this activism, he reflects on this history, he reflects on all of this. But I mean, he also talks about his health regimen. At 73 years old, man, this guy can get it.
That's our power.
Yeah, that's why it's kept. That's our superpower.
Yeah.
Wow, that's a lot to kind of take in one episode. I'm so glad you joined us for this today, because I would like to think that STI is a thing of the past, but I think it's going to be with us for as long as we have a pulse. It's just we're going to have a different way to combat it in the future. But right now, this information is essential, particularly for men of a certain age who are kind of broadening their scopes when it comes to their sexuality. So I really appreciate what you brought to the table.
Thank you so much. And again, I mean, people don't remember anything else. The takeaway here as far as STIs is that this is the first time in history that we have a way to prevent STIs. It's always been reactionary. It's always been about testing and treating. Now we actually get to prevent. So this is called doxypep. Doxy stands for doxycycline. PEP stands for post-exposure prophylaxis. But in my world, PEP stands for proactive empowered pleasure.
All right.
This is the first time in the STI world that we've had proactive empowered pleasure. And again, we've seen in where people adapt this, where they get on board with this, that community rates can drop very quickly. And all it takes is to get some people on doxypep, because once you're on doxypep and you don't have STIs and you're the belle of the ball and the bottom of the sluts and everything, then you're not passing STIs. And this is how we see STI rates come down on a communal level.
Yeah, it's not just protecting you, it's protecting your community and the people you love. So it's a group effort.
It takes a village. A very
That's
slim.
Greenwich Village. And before we wrap up, so you and I talked about the National Sexual Health Conference, which will be at this coming July 23rd through the 26th. You have Tub Talks, and Rob, I'm hoping that we can, like put the link up for Tub Talks on this, like at the bottom of the screen. Like make that part of the podcast. Damon, is there anything else that's coming up for you that you want to do some shameless plugs for?
Well, again, I mentioned earlier, mental health and sexual health, they're one and the same. One is a conduit of the other. Sometimes people want to work with a therapist or a mental health professional who understands these issues. If people want to talk with me about this, they can also reach out to me, DamonLJacobs.com, or email me at Damon@DamonLJacobs.com. If they want to consult or learn more about that, or sometimes people, they want to work with a mental health professional virtually who can help them understand how they can enhance sexual and mental health. I'm one of the people, not the only one, but someone who can help with that as well.
This is your moment. Claim it. So you are that. Well, because of FCC, I can't say what I'd really like to say, but you are that one. You are one of one. You are the only one.
Thank you. And thank you both for this platform and this great show with such great, empowered, fun ideas and playful ideas about getting older with power and purpose and pleasure. It's just that part of this world today does excite me a lot.
Aw. Okay, you win.
Right. You're our favorite. Oh, and as we usually do for our guests, so now that you've appeared technically for the second time on the show, including our crossover, how did we used to say in when I was getting ordained? Now you will be known. You are not just Damon Jacobs. You are now Daddy Damon Jacobs.
Ooh.
So you are a daddy now. You've gone through your trial of fire.
Okay.
Or in this case, your trial of bubbles.
All right, for tribal elders.
Okay.
All right. So with that, again, we want to say thank you, not only to you, Damon, but to anyone who has joined us. And Rob, shall we try once more with feeling?
Oh, Lord.
Let's see if we're going to get this right this time.
All right.
And on behalf of Daddy Rod
and Daddy Rob,
remember to always listen to Daddy. I can't even.
Jesus still loves us. That's all I care about.
Wait a minute. He knows our hearts. Yes.
Yeah, exactly. We're together.
All right.
And someday we'll be in the same room. That'll make it so much
It'll
easier.
make it so much